Hi everyone, I hope you guys are doing good. So, I recently had a comment about prometric examination. So, I'm just making a video so that it becomes easy for everyone to understand this. There's a new syllabus which is being ruled out by QCHP for prometric examination for general dentists who is looking for prometric or who's planning to come to this country. So to tell you that all the examination for all the doctors, you can give the attempt for 5 times. It's like a 5 consecutive exams. What you can give with the gap in between each should be any attempt. A gap, sorry, whatever the gap between the each attempt. So you can sit to qualify the exams for 5 times. Like for the 5 consecutive time, you can sit to qualify your prometric exam whatever the gap between each attempt. So there's no limit for the gap which you need to take in between if you do not qualify your first exam. And for general dentist, there will be total of 150 MCQs, which will be 3.5 hour duration. You need to qualify or get a cutoff of 60%, and that's for the general dentist. I hope it's clear, and it's almost the same for all the specialties such as general practitioners or pharmacists, and for the others, it's only 50%. Like physio, dental assistant, hygienist, dietitian, it's only 50%. And for like specialist, it's 65, like dermat and everybody, it's 65% is the cutoff marks. For nephrologist, neurologist, gynae, ophthalmologist, orthopedic surgeon, then pediatric surgery, then comes plastic surgeons and etc. Okay, so I hope, in fact, for general dentist, for specialty dentistry, you can only sit for 3 consecutive times, and you need to have 65% of the cutoff, and it's same 150 MCQs, 3.5 hour. For oral surgery, oral maxillofacial surgery, endodontist, orthodontist, prosthodontist, restorative dentistry, periodontist, and pediatric dentist. Okay, I hope it's clear now. Now I'm just going to go to the syllabus which was recently been ruled out. So this information you can easily get it on the QCHP website. So please don't refer any source, any source. Why I'm telling you this is because their policies keep on changing every now and then. So you cannot trust this document also in coming month or two. So please be very vigilant in opening the website, going through it personally, and then only verifying your information. So how this national general dentist examination syllabus goes like is, it will be like total of 150 MCQs and 3.5 hours, which I've already spoken to you before. So it will be like a scientific knowledge in which scientific knowledge will be 35%, biomedical science 30%, and evidence-based practice will be 5%. To be very honest, this is what is the current syllabus also. It's not like something new, it's just like they have documented this process so that it becomes easier for you to understand. Then comes the clinical skills, which will be 100. In that, it will be divided like patient assessment and diagnosis, comprehensive treatment planning, health and safety, management of emergency, disease prevention, oral health promotion, and population health. So it's like divided into 10 6 6 6 6 6 number of items each. So this is how they will divide, and this is like an easy thing for you, so that you know that this is how the exam will be divided into, and it becomes very easy. Trust me guys, don't be very much into that like get vigilant enough that nahi hoga ye bahut difficult. It's not. You have everything ready made now. You'll come to know that this many questions are going to come from this many topics. So for example, as I've mentioned, then control and pain anxiety 5 question, how do you control pain? This is, I think, common thing which we regularly study. Then comes periodontist, periodontic question 10, pediatric question 10, Then orthodontic will be 5, restorative dentistry will be 16, prosto will be 10, oral surgery and medicines will be 10. So now you have everything clearly mentioned, like effective skills like communication skill, professionalism, ethical and legal thing, team working, management and leadership skills. These are divided, and this many questions are going to come from 150 questions, and these are the topics. This is a subject which you need to prepare. So now it has become more easy, isn't it? Like you have a cutoff of 60%, which they have already mentioned in the page number 1. Coming to page number 4, then they tell you that from where these questions will come and where what book you need to refer. They have asked you to prefer some Odell's the clinical problem solving in dentistry at Glaze. Then Oxford handbook, which is very good thing that you need to read this Oxford book. People who are planning to go to UK, US and all, they are preparing from Oxford handbook now, which we I mean, for me, my professors used to say that you should read this Oxford book, which we didn't do that. But now if you have these things, you can know the clinical dentistry Oxford handbook is what is very much useful. And they have given you that. It's so good. Now they have given you the books which you need to refer in general. Then comes the Master Dentistry Volume 1, oral and maxillofacial surgery, radiology, pathology, oral medicines. Then comes the Master Dentistry Volume 2, restorative dentistry, pediatric dentistry and orthodontics. So this is very easy. Now for anatomy you need to prefer the dental student book, oral anatomy, oral histology and embryology book, I think, which we studied the same book. And they are giving you the author's name as well. So it's so easy now. It's so easy. For physiology, which book you need to refer. Then comes systemic pathology, dental law and ethics, which book you need to read. um, for radiology, they have given you UK guideline provider. There is a good regulation for the radiology, ionizing radiation. You can click on that link and study from there. Then dental material books they have given you, which you need to refer, which you need to study. Restorative dentistry books have been mentioned. Handbook for, see, I think Malamid is what we have always studied for local anesthesia. So we all know about Malamid. So this is what they have mentioned. You need to study for medical emergency in dental office. Study Stanley Malamid. Handbook for local anesthesia. Study this. For emergency in dental practitioner, you need to go to the Council of UK. They have given you the website where you can read these emergencies. Well, guys, I think this is the best thing which you have. Reading the list of the presented as a guide only, and the candidate are expected to meet the learning outcome of the examination which are available on the website of the DHP. Candidates are advised to ensure they use the latest edition of checking the website for the relevant publishers. What else, guys? I mean, they have made it so easy for you. This is just so that it becomes easier for the ministries as well, and for you guys as well, because we used to go to many sites, local books and this and that. Now when you know that this is what you need to prepare, you will be like 100% into it. So for me, it's a win-win situation. It's not difficult, guys. It's very easy. Sometimes it may get difficult, but yes, you need to make it easier. Study, prepare for it. And as I've mentioned, it advised to assure you to read the latest edition by checking the website, and every now and then go to the website and read about it.